Hi, this is David Sword from the College of Health Professions and Weight Management Center. I'm a licensed physical therapist and a clinical exercise physiologist. This presentation is on exercise for weight management. Exercise and weight management, the special considerations when beginning an exercise program. We want people to emphasize low-impact activities to reduce the risk of injury when they're first starting an exercise program for the specific role of losing body weight. Activities like walking, biking, swimming are all excellent choices in terms of low-impact aerobic type activity. Other special considerations, we know that any physical activity is good. More tends to be better. Anything that you can do to add activity to your day will benefit you if one of your goals is weight management. Examples listed here include parking further away from work, or if you go shopping a little further away from the store. When you have the opportunity to take the stairs rather than taking an elevator, that's a great strategy as well. While you're at work, finding a restroom or drinking fountain that's a little more remote from your workstation, a little further away, so you have to be more physically active during the day if you visit the restroom or drinking fountain. Doing housework, yard work, those are all great ways to be physically active. Taking your dog for a walk. It's good for the dog, also good for you. You should be aware of any existing conditions that you may have that might require special precautions during exercise. These could include, but are not limited to, conditions like high blood pressure, diabetes, a heart condition, musculoskeletal limitations. You may be able to safely exercise. You may need to take some sort of precaution or make modifications. If you have any questions regarding this, you should consult with your physician. It's also important to recognize signs or symptoms of exercise intolerance. So if any of the signs or symptoms listed below develop while you are engaging in an exercise program, you should stop the exercise and consult with your physician. This would include any pain or discomfort associated with the physical activity, excessive shortness of breath or unusual fatigue, nausea, lightheadedness, or a drop in your blood pressure with physical activity. Should also be cautious about exercising in the heat, especially if you're unaccustomed to being more physically active. Thermal regulation may be impaired in people who have excess body weight. It's an important consideration. To maximize weight loss through exercise, remember, some is good, more is better. If you're just beginning a program, you should really place the greatest emphasis on doing activity frequently and gradually building up the duration of the activity. In terms of intensity or how hard you're working, that can be addressed later on as you become more accustomed to the exercise. So to begin with, a moderate intensity level is appropriate, something equivalent to the effort involved in brisk walking. You should progress the volume of exercise slowly with a goal of working up to at least 150 minutes per week. This would be equivalent to 30 minutes a day, 5 days a week of some sort of aerobic type activity like walking, biking, swimming. The good thing is the 30 minutes does not have to be completed all at one time. So if you're just beginning an exercise program or just starting to become more physically active, your goal might be 2 15-minute sessions a day, or perhaps even 3 10-minute sessions a day. Tools like pedometers, Fitbits, exercise diaries, these are all helpful in assuring that we sort of stay on track with our program. They can really help motivate an individual to get in their exercise or their steps each day, and can increase compliance. As mentioned earlier, exercise volume should be increased gradually. So the amount of time we're spending exercising, such as a brisk walk, we should gradually increase that over time. Remember, the initial goal should be to work up to 150 minutes a week, which is consistent with the public health recommendation for physical activity for health benefits. If your main goal is to help manage body weight or lose weight, then the recommendation is trying to work up to a minimum of 250 to 300 minutes per week of moderately intense activity, like a brisk walk. This would be equivalent to 50 to 60 minutes of activity each day, 5 days per week. It may be helpful to vary the routine so you don't become bored, and also to prevent injury. So some days you might spend time on a bicycle, other days walking. In the summer months, swimming might be an option for you. And if you enjoy group activity, group exercise classes can be very motivating and a great way to get your exercise minutes in. As you become fitter and more accustomed to the exercise, including short bouts of more intense activity can also be helpful from a conditioning standpoint. So during a 20 or 30-minute exercise session, you may include short bouts of more intense activity for 1 to 3 minutes. Also, including resistance exercise 2 to 3 days a week can be very helpful. This type of exercise will help maintain or increase muscle strength and muscle mass, and will also help you maintain a higher resting energy expenditure or metabolic rate even while you're losing weight. I hope this information was helpful. Thank you.